My name is Bob Stein. I'm the CEO of the Kindred Hospital Houston Medical Center, and I'm going to talk a little about Romeo. Romeo's been here about 13 years, and he's had a number of different roles here. He's now a staff nurse. In the past, he was a supervisor. He is just a fabulous employee. He is one of the most compassionate, caring nurses I've ever worked with. In all the years I've worked with him, all I have ever heard is rave reviews from patients and families. And I wish we could clone Romeo, because clearly just one of the most compassionate, caring individuals I've ever met. And I know what some family members and patients used to tell me when Romeo was the supervisor, and I know he still does it. Before patients go to sleep, he'd say goodnight individually to every single one of them and make sure everything is all right with the patients, and just a unique guy. The other thing I need to mention is it's an amazing, we get a lot of online reviews, and it's just amazing how many times they mention Romeo in the most glowing of terms. So all in all, I think he would be a great winner of the Paul Diaz Caring Award. And I highly, highly recommend him for the award.
Hi, my name is Charlotte Unsucker, and I think the best way to talk about Romeo would have been to reverse the camera, let Romeo walk in the door, and see what aura he brings into a room just by walking in the door. Everybody smiles, everything relaxes tenfold, and then he gets busy, and he can cover a whole room. And you won't even know he's doing it. But he leaves, feng shui. Everything's perfect. You didn't really see him do it. And it's like, God, somebody else's turn. So anytime he comes, he's always welcome. I met him by becoming part of his coffee clutch. And I've been lucky enough to have him a few times as my nurse. There are more days, so I hope I get him a lot more. Y'all enjoy him.
Hi, my name is Dr. Julie Nguyen. I'm medical director at Kindred Houston Medical Center. I want to talk about Romeo, one of the nurses here at Kindred. He's a wonderful, paid with utmost respect, and always very collegial and friendly. And I think he'll be a great candidate to be considered for the Paul Diaz Award, and I give him my highest recommendation. Thank you.
Hello, my name is Romeo, and I'm a registered nurse here at Kindred Medical Center in Houston, Texas, and I've been here in Kindred for almost a decade. What drives me to be the best, it just goes naturally. Every day is a challenge for me. My patients are my strength, and I'm very grateful. Every day I'm very grateful and happy to have this profession. Not only a job, but I believe it's more a calling from God.
I've been a patient at Kindred for about 5 months now, and it's funny because other patients actually asked me did I have Romeo, but I had never had him before, and so I finally got a chance to have him, and when I had him, I immediately knew what everyone else was saying about him was true. He's very caring, and every time I have him as a nurse, I never need anything. He always knows what I need, when I need it. He makes me feel like family, not just another patient. And that's what's amazing about him. I always tell my parents that Romeo is not only my nurse, but he's my psychiatrist, he's my friend, my family member at the end of the day. And I think that's what makes him stand out. And then not only that, it's also he puts a lot into his work, and he's really passionate about what he does, and everyone just loves him.
For all of Romeo's patients that he cares for here, he's very caring. He treats them with the utmost respect. He jokes with them. He makes them laugh. Romeo, I believe, cares for his patients more than they will ever know. He's very, very patient-oriented individual. He does. Like, we had one patient that was very sick one time, septic, Romeo stepped in, called the doctor, had the doctor to adjust the medications or whatever. A couple of days later, the patient was doing a whole lot better. That's the kind of nurse Romeo is. He is pro-patient.
I've worked with Romeo for over a decade now, and he is an amazing nurse. He goes above and beyond for all of his patients, for their families, and also his coworkers. He's always been there to help me out. He teaches other nurses. He has an amazing way about him. I'm in a customer service role now, and so I talk to all the patients and all the family members, and I have never heard an unkind word about him. They have rave reviews for the things that he does that are above and beyond what's expected of him. He is great with the patients. He's a great asset for our company.
As soon as I clocked in, I considered it to be my last work here in the medical center. I give my 100% energy, dedication to my work. As soon as I enter my patient's room, I make sure that my patients are safe, comfortable, and happy. I interact with their family members. I make sure I answer their questions. I make sure my rooms are clean, my medication box are organized, and I know what to say, or I have the answers for their questions, and I assure them that I will take care of their family members.
My name is Hunter Davis, and I'm the Chief Clinical Officer here at the Medical Center. And I've been with Kindred for over 3 years, been in healthcare nursing for over 25 years. And when I first came to the Med Center here, I kept hearing about a nurse named Romeo. And quickly I learned who Romeo was. He is an extraordinary person, an extraordinary nurse. And working in this environment, you would like to think that we are all completely dedicated to our jobs and to the mission of taking care of people with passion every day, every patient. But you actually do meet somebody occasionally who lives that out, and it shows in their work every day. And I see that in Romeo. I see what our patients tell us about him. When you go to the floor, he is at the bedside of any patient, whether it's his or not. He is having a conversation with them and asking them about their care and what can he do for them. He says before he leaves the room, what else can I do for you? He proactively looks at events throughout the day that would make their day better for them. He truly helps coordinate the care with the other disciplines and make sure that there are no gaps in the patient's care. His patients very frequently get attached to him and will ask for him specifically. And even we get into situations where patients are upset when they cannot have him as their nurse. And I almost made the mistake, as a leader does often, in whenever you see someone who excels so much at their job, you automatically want to pull them and put them as a leader or as a supervisor. And being new to here, he was one of the first things, the first persons I thought about, I want him to be a house supervisor. And then did a little bit of conversation and research, and he had actually been in a house supervisor position before, and I'm sure he got there because he did such a great job and leads by example and performs by example. But after doing that a while, he wanted to go back to the bedside. He felt like that's where he made the best impact and was able to directly affect the patient's care. And now then, after being here, at this facility for 5 or 6 months, I too agree that the best place for him is being at our patient's bedside every single day. And that if he's on, not only his patients, but probably every patient on that floor is going to have an incredible day, or at least the best day that they can, with him providing care for them. It's a natural thing for him. It's part of what he does. And to me, that's what makes him unique, is that it's totally him. It's what he's all about. It's providing care and making sure that every patient has the absolute best experience and for sure the best day when he's on. I think that he would be a perfect nominee for the Paul Diaz Award and is an extraordinary person and an extraordinary nurse. I'm very happy to be part of this team.